external body part to cure the cancers. It has impact on the nervous cells. It means that those side effects are inevitable. And lately, the new advanced technology applied to the advanced RT by the targeting tumor cells precisely. But there's also challenging. So radioligand therapy is struggling with the balancing of the safety and also efficacy. And also there are some limited efficacies are mentioned about by the many developers and researchers. So combination therapy is inevitable.
Awesome.
So radiotherapy, radiosensitized VS101 is a small molecule developed by the repurposing an existing drug. So we believe there are four strengths over the VS101. First thing is repurposing an existing drug. It is very safe. We expected to minimize the toxicity over the VS101. Its API has been used for over 20 years for human beings, and also we tested only 10% of the approved dose for the human beings. A second thing is that we are confident in its efficacy because we validated its increased efficacy by having multiple mechanisms of action. One is the modulating the IAP, and another one is the modulating the DDR pathways. Third thing is we can go through the all types of solid tumors. We can call it a tumor agnostic, a radiosensitizer. We have already approved from the US FDA for the head and neck cancer, breast cancer, and glioblastoma. And also we have evidence for the efficacy in other solid tumors, such as prostatic cancers and pancreatic cancers. So that's why we call it a tumor agnostic radiosensitizer.
You're good.
Last thing is very important in terms of the patient's benefits. Each oral agent is very easy to use for patients and physicians because considering in competition with the other radiosensitizer require the injection, especially intratumoral injection, it is very easy to use.
Wow, because it's oral.
Yeah, it's oral, very easy to use. So this is illustrate how VS101 increased the efficacy of radiotherapy. When irradiating the radiotherapy to the tumor cells try to survive from the radiotherapy by the DNA damage response pathway, and another one is that activating to the inhibitor of the apoptosis. It means that they are getting the resistant to the radiotherapy. By inhibiting the IAPs and also modulating DDR, we can expect more increased efficacy of radiotherapy. This is the evidence of how the VS101 modulating DDR pathway. You can see here VS101 modulating the DDR pathway in prostate cancer and the breast cancers. This page you can see that VS101 inhibits the various subtypes of IAPs. So this is important for us because FADU, it means the head and neck cancer cell lines, and FADU, head and neck cancer is the very famous in the radio-resistance tumor cells. So that means that if we succeed in the as a radiosensitizer in for head and neck cancer, we can go through the other solid tumors by easily. So, and another thing is highlighted is over here, we inhibit the survivin and livin, and that's the important because they are normally observed in the cytoplasm and also nucleus. That's why we believe VS101 can be a potent radiosensitizer.
But how does it get through the blood-brain barrier?
That's a good question. That's why we get into the space of glioblastoma. Its API has been used for psychotic disease. It means that VS101 is capable of BBB penetration. This is our first data for the head and neck cancer. In the left side, you can see the mouse data. On the right side, our first human data. So you can see here, the black line shows the radiotherapy alone, and the combination therapies show the increased TGI. But the most interesting, we call it a pure radiosensitizer because VS101 does not effective for TGI by alone. And also you can see here VS101 in the human there's no negative impact on the ECOG performance status. And also we take objective response rate as a secondary endpoint. All patients show that totally respond to the treatment.
30 seconds.
So this is a highlight. So the latest data of the GBM. So a week ago we got third IND approval from the US FDA by using this data. So we very excited because VS101 showed that efficacy as a radiosensitizer and also chemosensitizer. So we can explore various potential of VS101 in GBM with our clinical trials in the US.
Awesome.
So this is our target indications. So I told you before, so skip this. So this is our market landscape. There's no approved drugs as a radiosensitizer, but there are some competitors under development. But we are very confident with the competition with the Merck and J&J. First of all, J&J developed a nanoparticle as a radiosensitizer. In nanoparticle, many patients are afraid of using for it because they have not enough data for the human safety, and also they are required intratumoral injections. And Merck and unfortunately they stopped their phase 3 clinical trials last year. So that's why we are competitive in this market landscape.
I think I asked you this last time. Why did they stop? Was it because it wasn't effective?
I can get a few minutes. So that's I can explain that. So Geminapant is an IAP inhibitor. So J&J is known as an RS generator. But because we have a multiple mechanism of action covering all other competitors has, and also we are oral agent, so it is much easier to use compared to the J&J. And also we are as a repurposing drug, so we are very confident its safety, especially compared to the DDRI inhibitors. So they are trying to increase the efficacy by combination DDRI and DDRI, but they are struggling to finding the optimal dose for not impacting on the safety issues. So that's why we are competitive in this market.
You are great. That was fabulous. Everybody has to do like her.
Thank you.
How come you're so good?
He invested me a lot of fortune and the time.